if I were having that irritable bowel and I was having diarrhea, constipation requiring medications, when do you have to do to find out? Do you have to do a scope, or is it just simple exam and history, or everybody's different?
Great question. So if a patient's in the older age group of, let's say, 45 to 60 or 70 years old, and they come in with irritable bowel symptoms, we're going to be more inclined to offer them testing up front, since the incidence of other conditions that can mimic irritable bowel syndrome that are more serious, like colon cancer, inflammatory bowel disease, can be more common. So we would tend to favor testing in those patients first before treating. In the younger patients, patients between the age of about 15 and 40, the tendency is, again, if they meet criteria and they have a typical story, to try to go ahead and treat them first before you offer testing. The only situation where that might not apply is if younger patients have any of the typical alarm features that we like to associate with the GI tract.
So you mentioned alarm factors. What are the alarm factors?
So any patients that have rectal bleeding or blood in the stool that's either visible in the commode after they've gone to the bathroom, or that's detected on one of those card kits that doctors give to patients frequently, would be considered an alarm factor. Anything that indirectly relates to blood loss, for example, anemia in their blood work, would be an example of an alarm factor.
Weight loss?
Weight loss would be considered an alarm factor because patients with irritable bowel syndrome will generally maintain their weight. It doesn't usually affect their nutrition, but in those patients who are losing weight, you'd be concerned about some other possible considerations.
So if a patient has the risk factors and you have to do endoscopy, you have to do colonoscopy, is that what you have to do, or both?
In most cases, although it depends on the location of the abdominal pain and their global history to some degree. If their symptoms are in the lower abdomen and their symptoms are relieved by going to the bathroom, so they have abdominal pain, they feel the urgency to go to the bathroom, they have a bowel movement, and they feel relief, then the tendency is, again, if there are alarm factors, to offer a colonoscopy first to look at the colon. If their symptoms are centered in the upper abdomen, sometimes we will also perform an upper endoscopy to look for gastric disease, ulcers, things like that.